All right. Good afternoon, everybody, and welcome to the webinar entitled "This is Diabetes Awareness Month in the month of November." Everybody. So today we're going to be talking about type 2 diabetes. Type 2 diabetes, everybody. So this is what the presentation looks like for On Time Ministries. So we're going to go ahead and stop sharing the screen. I'm going to get into a few links today, everybody, for you to all look at. This is streaming live on the On Time Ministries YouTube channel, as well as the True Solitude 1000 YouTube channel, as well as Twitter today, everybody. So we're covering all three ministries, well, all three platforms, minus Facebook. Well, I will share this presentation on Facebook too. Okay, and I'll put the link on the True Solitude IG and the On Time Ministries IG page. So the first thing I want to share with you, we're talking about diabetic medications, okay? So what we see here is a lady talking to the pharmacy about the medication. So what we have here is just a couple of things to kind of consider of. If lifestyle change such as losing weight, eating healthy, and engaging in regular moderate physical activities are managing your blood glucose levels, you may need medication to help reduce your glucose level and your risk for heart disease and strokes. Your healthcare physician will decide which medication and treatment plans are right for you based on your lifestyle, physical condition, cardiac risk factors, high blood pressure, or cholesterol, response to medication, and insurance coverage. Okay. So this is just some of the things that I wanted to share with you about that expertise as well. And then it goes on talking about the combinational therapy. There are different types of classes of drugs that works in different ways to lower blood sugar. People newly diagnosed with type 2 diabetes are prescribed with metformin as the first line therapeutic in addition to lifestyle changes. Metformin decreases the amount of glucose made in your liver. That's what my daughter takes. She first was diagnosed with diabetes back in 2017, and she was on insulin. She was taking the long term and the short term for quite a few months, and then all of a sudden the doctor decided to kind of cut down her doses and then transition her from taking the insulin pen shots to the metformin medication, and she was taking it now for a few years. And there's a 500 milligram tablet that she takes, but she had to take it one in the morning and one at dinner time. And of course she takes her vitamin D on the weekend to kind of bring her vitamin D levels up, everybody. Okay. If you have additional CVD risk factors and lifestyle changes, metformin are not controlling your blood sugar well enough, additional medications may be needed. Your healthcare professional may add a GLCP-1 repellent agents or a SGLT2 inhaler to your regimen. So they may add extra. So most of you like, what are these things? And I'm glad you may ask this question. These are the answers of what these two insulins does. So the first one is a GLP-1 represent agent helps release the insulin when you need it and lower the amount of the glucose made by your liver. Some medication within this class have benefited from your heart and kidneys. And the second one was the SGLT2 inhaler prevents glucose from being reabsorbed in your kidneys. Some medication in this class have been shown to reduce the heart failure and chronic kidney disease progress. So we have the insulin here, and you have various insulins that you're using here. You have the syringe, a needle connected to the whole tube holds the insulin and push the insulin down into and through the needle. So I've used that for someone. And when you use the insulin needle, you got to make sure when you do it that there's no bubbles that get inside the needle, okay? Because you don't want air going inside when you're putting your insulin in. So you want to make sure it's measured the right way. You want to make sure you clean it and sterilize it. And when you do your insulin shots, you don't want to always be in the same place. You want to put it in different spots of your body, okay? Your stomach, where else? Your arm. You may do one arm one day, you may do all the arm another. Or how would I say, you may do one arm that the afternoon and the evening, do that one, and you do one spot in your stomach. As long as you're doing in different parts of your body, it's not in the same spot when you take your insulin. So now with the insulin with the pen, the insulin is already in there. All you have to do is adjust it and measure it to the right point where the insulin goes. So that way, if you have to take 4 pints or how many ounces or how many ounces of that, That's where you measure it out on the pen, and you make sure you twist it. And then when you twist it, you make sure it's good, because the insulin pen already has the insulin in it. And with insulin, you have to keep that refrigerated along with the glass insulin, as well as the insulin with the pen. So you have to keep both of those refrigerated. You can't leave insulin out, it won't be any good. You have to keep it refrigerated, so that way you can use it. The difference between the syringe and the insulin pen, with the syringe, you have to replace the needle over and over again. With the insulin pen, you have to replace the needle, but it's a pinch in needle where you stick into the insulin pen. It's not like one of those needles that when you get like a vaccine shot. No, it's a whole different type of needle, because with the syringe needles, you have to switch that. You have to change that needle. You can't use the same needle when you do the insulin shot. That's the same as the insulin pen. You have to take that needle off there after you've done that, and redo it over and over again. Make sure you clean it and wipe it and all of that, and prunk it in there. But the difference is, this is like this for the insulin pen. For the insulin pen, is like the needle is like this small. It's like half the size of the syringe. It's like a twist thing, and you puncture it right inside, and you stick it inside there to do that. With the insulin pump, it's a device that is attached to you, and it's worn on your buckle, and it's basically regulating the insulin to get inside of your body. So that's the difference between all different things regarding with insulin, everybody. So now the one here about inhaling insulin, I've never heard that one, so we're gonna learn something today. Inhaling insulin starts working in 12 to 15 minutes, peaking in 30 minutes, and is out of your system in 180 minutes. It inhales at the beginning of each meal and is used in combination with injecting long-acting insulin. Rapid-acting insulin begins to work about 15 minutes after injecting, peaks in about 1 to 2 hours, and continues to work for 2 or 4 or 5 hours. No, 2 to 4 hours. Regular or short insulin inhalers usually get into the bloodstream within 30 minutes of injections to peak 2 or 3 hours after injection, and is effective for about 3 to 6 hours. Immediately acting insulin typically gets into the bloodstream 2 to 4 hours after injection, and peaks 4 to 12 hours later, and works for about 12 to 18 hours. Long-acting insulin reaches the bloodstream several hours after injection and tend to lower glucose level fairly even over 24 hours. Ultimate long-acting insulin reaches the bloodstream in 6 hours and does not peak and last 36 hours or more. So your doctor will work with you to determine the best type of dosage to manage your diabetes and fit your lifestyle. So the doctor has to go through your chart and see what is a good remedy in terms of what you can use for your insulin, and how is your diabetes, and where is it at, and how do you manage it, and how many dosage of insulin do you need. And they have different varieties of insulin, depends on where your glucose level is and what your blood work says. Your blood work tells a lot of things about what's going on with you. And they go on based like, okay, what does the pancreas function look like? What does the blood level look like? What are the numbers? And when they look at the numbers, that determines of how much insulin and how much doses that you get with your insulin pills, as well as your insulin syringe or the pen, or even the pump that you use. So they go by your blood work. So it's very important to pay attention to that. So when you go in and they order blood work for you, they want to see how your levels are. They want to see how your A1C is. They want to see how your vitamin D is. They want to see how your liver and your kidney function, as well as your pancreas function is working. And that determines on if they have to give you extra regimens to supplement what you're taking in terms of where your diabetes is at. Okay. Medication to reduce cardiovascular disease risk. Medication to prevent heart disease and stroke. So these are some of the regimens we talked about, the GLP-1 and the SGLT2. These are different medications. These are additional medications you take along with that. And they're talking about some of the things that you have to pay attention to. It decreases the glucose production by the liver. It slows food moving through the stomach. It reduces absorption of glucose via the kidneys. So there's a lot of different medication, because when you take a lot of these strong medication, you have to be kind of mindful of how that works for you. Now it talks about the high blood pressure medication and how it goes. And they're talking about if untreated high blood pressure can damage blood vessels and heart and other organs, ultimately causing death. Your doctor may prescribe one or more type of medication to get your blood to the target range. Follow the medication regimen as a prescription and notify them if you experience side effects. Okay. So then we're talking about the cholesterol. So they're just going in details about how how each medication is supposed to make you feel. And if there's an issue, they're gonna get on the phone and call the local, emergency to get the assistance that you need. Now we're going to talk about this one's talking about cholesterol. We're going to read that briefly. In addition to eating healthy diet, cheating on maintaining a healthy body weight, and engaging in regular monetary and physical activities, you may need to lower your cholesterol levels and reduce your heart disease risk. And they're talking about that heart because you're taking this strong medication, and you want to make sure your heart is at a great place in terms of numbers, so that way it doesn't go below or go a little too high where it's like, woo. So you have to be very, very, very proactive about what's going on. So they're talking about aspirin therapy. So diabetic is at more risk for cardiac disease and stroke depending on your medical history. Risk factors. Your doctors may recommend lower doses of aspirin regimen. So they recommend that you take lower dose aspirin because you're taking strong medication anyway, and you're a high risk because you're diabetic. So they don't want you to take so much of that. Aspirin thins the blood and helps prevent blood clot from forming, which can block blood flow through arteries, especially when they're already narrowed by plaques. Don't begin an aspirin therapy on your own. Ask your healthcare physician to learn more about that. Additional research. Learn how to make the most of medication plans to help you and your healthcare keep up with the medication use. This handy medical chart. So we're going to come back on here next Thursday to give you some more insight about the different type of medication, because I feel that we need to really kind of dive on this, because people need to know what they're taking in their body, and they want to make sure that they're taking the medication and using it the proper way. They're not taking too much, or they're taking little, or they're taking just about enough. So we're going to touch bases on that again, everybody. So I'm going to stop sharing my screen. I'm going to get to the next part of this. So now we're going to get into the insulin treatment. So this is what it looks like, everybody. See how that pen, see how that pen has a needle at the end, everybody? So that's what that insulin pen looks like and how you perk it. And the insulin's already inside, okay? But you have to keep it refrigerated. So I just wanted to show you a basic instruction of that. So why should I use insulin? With type 2 diabetes over time, the pancreas is often unable to produce insulin on its own. When that happens, your blood glucose level will become very difficult to control without daily injections of insulin. Injectable insulin is identified the insulin made by the body, but can be catalyzed into two different bases. Basal insulin, a long-acting, immediate acting insulin, keeps your blood stable all day long, even when not eating. With bioinsulin, a rapid action, short-term insulin helps your body respond to quick and rising blood glucose for after meals. You might need insulin if you're having trouble concentrating, controlling your glucose with diet, exercise, depending multiple oral or non-insulin injection diabetic medication. Your HbA1c level is higher than 10% diagnosed, or your blood glucose level is higher than 300 milligrams at any time of the day, or higher than 250 milligrams after not eating for at least 8 hours. You have side effects to other diabetic medication that have poorly controlled glucose. You often experience the thirstiness, frequently urinating, or other symptoms of high blood glucose despite taking other medication. So here's a quick video to kind of give you an insight of what this looks like, everybody.
If you have diabetes and have been prescribed insulin to take via an insulin pen, there are a few things that you should know. There are many kinds of insulin, and your doctor will decide what insulin type, amount, and injection times are best for you. It's understandable if you're feeling a little nervous or anxious about taking insulin injections. But with a little practice, you will see that it takes only a few seconds to do and can be rather easy. To ease any anxiety you might have about taking insulin injections, we will demonstrate how to take an insulin injection using an insulin pen. Now, let's begin. First, start by washing your hands with some soap and water. Prepare the insulin supplies and make sure you have the following items. The insulin pen, alcohol swab or cotton ball moistened with alcohol, and a new insulin pen needle. Prepare the insulin pen. Always remember to check the label and the color of the insulin pen. Remove the cover of the pen. Take your alcohol swab and wipe the tip of the pen where the needle will attach. Some insulin pens, like NPH or mixed 70-30 or 50-50 insulin, will need to be gently mixed before use. These types of insulin look cloudy or milky white and need to be gently mixed by rolling a pen between your palms. If you're using a different type of insulin that looks clear like this one, you do not need to mix it. Only the cloudy insulin needs to be rolled. Take a new pen needle and remove the protective tab. Insert the needle into your pen and screw it on until it is secured. Now you want to prime the pen, which means removing air from any of the needles. We do that by dialing the pen 2 units, then remove the needle cover. Point the needle up into the air. Tap on the side of the pen, and then press down on the knob. By doing this, you primed the pen and made sure that insulin is going through the needle. Set the pen to your dose. Turn the knob until you see the correct dosage. Now it's time to choose an injection site. Insulin can be injected into any of the following sites. The stomach. This is the preferred injection site. Stay at least 2 inches away from the belly button or any scars that you might have. You can inject insulin into the fatty tissue at the back of the arm, or the top and outer area of the thigh, or the upper and outer part of the buttocks. Remember, the insulin needle goes under the skin only, not into the muscle like the flu shot, for example. Insulin injections in general are easier than intramuscular injections. Avoid injecting cold insulin, since this can cause discomfort. When using the insulin pen or vial for the first time, take it out of the fridge at least 30 minutes before injecting so it has time to warm up. Rotate the injection sites to use a slightly different spot with each injection, and avoid injecting insulin into scar tissues or hard lumps that you may have. Insulin might not be absorbed as well if injected into these areas. Injecting into the same spot too often can cause hard lumps under the skin and can impair insulin absorption. You can rotate the injection sites in a pattern that works for you. Examples of rotation patterns are shown here. Once you've chosen your injection site, wipe it down with alcohol to make sure that it's clean. Now you are ready to inject the insulin. Gently pinch the skin with your free hand and quickly insert the needle at a 90-degree angle. Release the pinch, push down on the plunger at a steady motion for about 10 seconds until the pen goes off to zero. Pull the needle straight out of the skin. Now that you've taken your injection, you need to safely dispose of the pen needle or syringe. FDA-cleared sharp disposal containers are generally available through pharmacies, medical supply companies, healthcare providers, and online. If an FDA-cleared container is not available, some organizations and community guidelines recommend using a heavy-duty plastic household container as an alternative. The container should be leak-resistant, remain upright during use, and have a tight-fitting, puncture-resistant lid, such as a plastic laundry detergent container. All Sharps disposal containers should be labeled to warn of any hazardous waste inside of them. Follow your community guidelines for proper disposal methods. You should always store unused insulin pens in the refrigerator at a temperature of about 40 degrees Fahrenheit or 4.4 degrees Celsius. Insulin pens can be used if refrigerated until the expiration date that's listed on them. It's likely that you bought more than one insulin pen at a time. You should store all extra insulin pens in the refrigerator, except for the one that you are currently using. Remember, do not freeze insulin or keep the insulin near ice. Do not keep insulin in a hot place, warmer than 86 degrees Fahrenheit or 30 degrees Celsius, or in direct sunlight. Do not use the insulin after the expiration date printed on the pen. You can keep the insulin pen that you're currently using at room temperature, below 86 degrees Fahrenheit or 30 degrees Celsius, for up to 8 weeks. The number of days or weeks depends on which pen that you use. Congratulations! You've just learned how to inject and store insulin. Taking insulin injections can be a very simple process, and the more you do it, the easier it becomes. If you'd like to learn how to take an injection using a syringe and vial, please watch the next video.
All right, moving on to the next one. This one. So I have 2 more slides, everybody. I just shared this live on my Facebook platform. So now we're going to talk about managing diabetes without insulin. Okay, let me click this pop off. So basically, just pop up everywhere. I'm just listening. So, in world, I believe that those with type 2 may easily need insulin if they have diabetes for long term. However, only about 20 or 30% of people with type 2 diabetes end up needing insulin injections. In this article, we'll explore whether it is possible to manage your diabetes without insulin. If so, how can we do so, and when they may easily need insulin if other treatments do not work out. Type 1 diabetes disclosure. So we're going to get a little bit into type 1. I'm going to come back on it next week to give you further insight of this, because we continue to talk about this each Thursday for this month, as well as Stomach Cancer Awareness Month. Make sure that you write your calendar. November the 17th is Worldwide Diabetes Awareness Day. In fact, I'll put that in the comments section on this platform to let you know. In fact, let me do it now while it's on my mind. Yes, it is November and the Worldwide Diabetes Day. Hold on, give me a second, everybody. Okay, see, Diabetes Awareness Day is November 14th. Okay, so mark that on your calendar, everybody. And let me go ahead and put that in the comment section so you can see it. All right, you'll see it on the YouTube channel, and you'll see it on Twitter, because Twitter will let you put that in the comment section of it. So we'll get back to this. So we're talking a little bit about type 1 diabetes. Type 1 diabetes, because it's implemented that people with type 1 diabetes require insulin every day without questions. A person with type 1 diabetes produces very little or no insulin. Without insulin, you cannot convert food into usable energy. Simply putting, without insulin, a person with type 1 diabetes cannot survive because they need the insulin every single day. Okay. So that's what that looks like, everybody. So they're showing pictures of fruit, and then they're showing pictures of fruit. And then they're just going along in details about different things. And then they have this insulin isn't not the bad guy. And it's just giving you insight about the do's and don'ts about it. And then they're showing some things about dieting and exercising. And they're just showing you all kind of different things to kind of be aware of. Here it talks about A1C, and I'm going to share some videos with you on that. I'm just kind of scanning through the website. The video is going to get more in detail about that and certain things you can do healthier that kind of help you eat better. And it goes on in details with that. Oh, sorry. Oh, what's going on with the phone? Status on mine today. It talks about exercise, physical activities, and weight loss. And then it talks about metformin medication. And it goes into talking about what comes after metformin and all the different things that are tied to it. That you can see right here. And it goes in details about some of the content that you're about to experience. I'm gonna let y'all read that for a little bit because I'm kind of crunched for time. Before I know it's time to jump in. And then the phone rings. That part. And it goes on in details about some of the things you should be aware of when it regarding a lot of different medications that you're taking. And it goes in details about the next medication that you should be aware of. So we're going to touch bases on these medications next week. We're going to come back to this particular website to share that information, but I wanted to kind of give you a chance to get a glance at what it really looks like and what it talks about. So we're going to come back to this website next week. I just wanted to give you an insight of that one. So I'm going to move on to the next website. Everybody, it's a lot of content. So the next one I'm going to share with you is talking about diabetes symptoms and what it's caused. So I'm going to read a little bit for you all. Using type 1. Here's what you need to know about type 1 diabetes. Type 1 diabetes occurs every age and even in people of every race, shape, and size. There's no shame in having it, and you have a community of people ready to support you. Learning as much as you can about it, working closely with your diabetes care team can give you everything you need to know. So having a support group is very important with having diabetes. You need that extra loop, and you need people who've been through it to give you good advice and give you some tips to use to help you navigate through your diabetes. It's very important to be through that. It's very important. And it goes on in detail about what you should do. And type 2 is the most common form of diabetes. And it means that your body does not use insulin properly. And while some people can control their blood sugar levels with healthy eating and exercise, others may need medication or insulin to help manage it. Regardless if you have options, and we're here with tools and resources to support your needs. So that's telling you what needs to be done with type 2 diabetes. Understand generic diabetes. Genetic diabetes can be a scary diagnosis, but it's like other forms of diabetes. Only it's one that you can manage. It doesn't mean that you had diabetes before you conceived or that you have had diabetes after your birth. It means that by working with your doctor, you have a healthy pregnancy and healthy baby, no matter what. Know that you have all supported your need for both you and your baby to be at your best. Okay. We don't know what caused genital diabetes, but we know that you're not alone. It happens to millions of women. We don't know that the pancreas supports the baby as it grows. Sometimes these hormones also block the act of mother's insulin to her body, and it causes a problem causing insulin to restrain. The insulin restraint makes it hard for the mother's body to use insulin, and this means that she may need up to 3 times as much insulin compensating. So this is another thing we're going to get into next week as well, everybody. So I want to kind of touch bases on a little bit. It's going to talk about the different causes and whatnot. But we're going to come back to these 2 websites on next Thursday at 12 p.m., everybody. Okay? Hold on. 12. It may be a little late because I know next Thursday is Veterans Day. So we may push this one to about 1 o'clock. This webinar will be 1 o'clock. As I just remember, there's a holiday next week, and then my kids will be home. So, yeah, we'll push that to 1 o'clock. That way I have enough time to share that with you all. All right, I got one more I want to share with you all real quick before I log. Oh, actually, I got a few videos I want to share. So there's one more thing before the videos that I want to share. So this here is a medication. That you see here, lowers blood sugar, is just the beginning. So it's just showing you the different blood medication that you can take. I'm not going to spend too much time on this website. And it's telling you the different things that's being taken care of and how is it handled and how it's maneuvered and what best choices for you to take. Okay, so I'm gonna click off this website real quick. Like, oh, Minister Johnson, can't spend too much time on those type of sites. So now I'm getting back to my presentation, everybody, because I'm looking at my time and I'm looking at the time flying by quickly today. So these are the sites I just showed you. So 2 of the sites I'll be sharing with you. We'll be going into talking a little bit more about this one here, as well as this link right here. Okay. And now we're going to get into the video structure of this, everybody. So we're going to kind of talk about this. The videos are on top of each other. See how long this is. Okay.
A1C test is a blood test used to diagnose diabetes and monitor the progress of a treatment plan. The test result reflects the average blood sugar levels in the past 3 months. A1C is a type of glycated hemoglobin, a hemoglobin that is bound to glucose. Hemoglobin is the major protein of red blood cells. A1C forms as a result of interaction between red blood cells and sugar in the blood. The higher the blood glucose levels, the more glucose binds to hemoglobin, the greater the amount of A1C. The A1C blood test reports the percentage of hemoglobin that is bound to glucose. Once a hemoglobin is glycated, it remains that way in the blood until the red blood cell carrying it is removed from the circulation. Because the average lifespan of a red blood cell is 3 to 4 months, A1C measurement represents the status of blood glucose for the past 3 months or so. A normal blood glucose level corresponds to an A1C result of less than 5.7%. An A1C level higher than 6.5% indicates diabetes. Between 5.7 and 6.5% is prediabetes. An estimated average glucose level, EAG, measured in concentration units, milligrams per deciliter or millimoles per liter, can be calculated and often reported in addition to the A1C percentage. EAG helps patients link A1C to the numbers they obtain at home using a blood sugar measuring device. A1C is an important tool for managing diabetes. For most diabetics, the goal is to bring A1C level down to 7% or less. However, patients' age and other health conditions must be taken into account when setting goals. In general, younger patients who don't often experience severe low glucose, known as hypoglycemia, need lower goals to avoid diabetes complications in the many years ahead. Older patients or those having frequent low glucose episodes may have a higher goal. It is important to note that several factors can affect the accuracy of A1C test results, in which case, unless corrections can be made, A1C cannot be used to assess blood glucose levels. For example, people with blood disorders such as sickle cell disease, thalassemia, or hemolytic anemia may have a lower than expected A1C because their red blood cells have a shorter lifespan. Iron deficiency anemia, on the other hand, is associated with falsely high A1C measurements. Some people of African, Mediterranean, or Southeast Asian descent may have uncommon forms of hemoglobin that produce falsely high or low results. Certain kidney and liver diseases may affect the turnover rate of red blood cells and give rise to inaccurate A1C readings. Finally, recent blood loss or transfusion will also skew the test results.
All right, everybody. This concludes this week's webinar for this part of the Diabetes Awareness Month. I'll be back on here next Thursday at 1 p.m. and share more concepts. We're going to look at the other videos next week. Talks about understand type 2, talks about treatment and management. We're going to get on type 1. We're going to talk about the different medication. We're going to be very thorough in next week's webinar, okay? I'm going to stop sharing my screen. All right, everybody, you have an amazing and a wonderful Thursday. I'm getting ready to jump on my next webinar in just a few, roughly about 2 o'clock. So make sure you tune in. Have an amazing and a wonderful day.